Hi, this is Dr. Firnhaber, and it's Wednesday, time for another 10 minutes of truth. So today I've got an article from the Journal of the American Medical Association, Internal Medicine. This article isn't even a year old. It was published in November of last year, 2023. The name of the article is Estimated Lifetime Gained with Cancer Screening Tests. So it's a pretty large study. It's a meta-analysis of several studies. It's a very large study, over 2 million subjects, 2.1 million subjects. They looked at 6 commonly used cancer screening tests, and they did follow-up studies on these tests. They wanted to see, do they really increase a person's longevity or lifespan? How valuable are they for that? So they followed up 10 years for computed tomography, prostate-specific antigen, and colonoscopy, 13 years for mammography, and 15 years for sigmoidoscopy and fetal occult blood testing. And the article starts out and says, cancer screening tests are promoted to save lives by increasing longevity. But it is unknown whether people will live longer with commonly used cancer screening tests. Now, isn't that interesting? It's a very interesting way to start this article because, most people, a vast majority of people in our culture would assume that that's why they use them, because it's been proven. Well, not so fast. So the 6 most common used cancer screening tests are mammography for breast cancer, PSA or prostate-specific antigen for prostate cancer, fecal occult blood testing for colorectal cancer, endoscopy, which is sigmoidoscopy or colonoscopy for colorectal cancer, computed tomography or CT for lung cancer, and Pap testing for cervical cancer. So here were the findings, okay? The findings, they said, we found no statistically significant outcomes for longevity with mammography screening or fecal occult blood testing screening with yearly or biennial screening. Colonoscopy screening and PSA screening have an association with longevity for about 5 weeks. So all those colonoscopies these people are getting, if you look at the real benefit of that, it may have the possibility of increasing your lifespan by about a month. Lung cancer screening among smokers or former smokers have an association of longevity for about 5 weeks. The best test was sigmoidoscopy, which is looking at, it's a modified form of the colonoscopy, and it had a chance to prolong life and longevity by about 3.5 months, 110 days. Fecal testing and mammograms did not appear to prolong life in the trials, while estimates for prostate cancer screening and lung cancer screening are really uncertain. There was no significant difference following mammography, prostate cancer screening, colonoscopy, fecal occult blood screening every year or every other year, and lung cancer screening. Now, the article says this, and I agree with this. Some individuals prolong their life due to these screening tests. Without screening, these patients may have died of cancer because it would have been detected at a later incurable stage. These patients experience a gain in lifetime. However, other individuals experience a lifetime loss due to screening. This loss is caused by harms associated with screening or with treatment of screening detected cancer, for example, due to colon perforation during colonoscopy or myocardial infarction following radical prostatectomy. For 5 of the 6 screening tests investigated herein, The findings suggest that most individuals do not have a gain in longevity. Now, it says these outcomes we observed are similar to those for aspirin used for primary prevention of cardiovascular disease and cancer. While the cancer screening tests we studied are widely recommended, aspirin use is not recommended for primary prevention of cancer, and the lack of recommendation for aspirin has been explained with too small effects and adverse events such as bleeding. Now, what are the conclusions of this article? The meta-analysis suggests that claims that screening saved lives are not substantiated by the best current available evidence. The findings of this meta-analysis suggest that current evidence does not substantiate the claim that common cancer screening tests save lives by extending lifetime, except possibly for colorectal cancer screening with sigmoidoscopy. So this is a very, I would say it's a very powerful article, very disturbing, and I'm not here to tell you whether to get screened or not. I'm not here to tell you whether you should have a mammography or a colonoscopy. You know, that's up to you. It's your body, your health, your choice. But it looks like out of their own journals, and JAMA is one of the most prestigious, most respected, authoritative medical journals in the world. It says that most of these cancer screening tests offer no benefit to the patient. And the ones that do offer benefit is not a lifetime that's extended very far. So whether you decide to get these tests or not, that's up to you. I just want you to know the facts and what the research says so you can make a better decision. So this is Dr. Paul Firnhaber here at Lincoln Disc and Nutrition. We're at 4535 Normal Boulevard, Suite 105 here in Lincoln, Nebraska. And if you'd like to get a hold of us, our number is 402-488-2220. So, you know, if you have some health issues that you've really been struggling with, you know, there's a chance that we might be able to help you. We don't know. We don't even know if this is the right office for you, if I'm the right doctor for you. But at least we could check you out and see if this is a good place for you. Listen, I want to bless all of you. God bless you guys. Stay healthy. Keep taking care of yourselves. And I'll see you next week for another 10 Minutes of Truth.